Hello, this is Dr. Tom Groover, and I am here with Erin Williams. And Erin Williams is a nutritionist, author, and speaker. And she's got a bachelor's degree in chemistry from Purdue, and I know that she's also a master's degree in nutrition and has a couple other credentials here. Let's see, certified nutritionist. I got that one.
Yeah.
Uh, and she's kept her licensed massage therapist uh, credential. I also know that you gave up a credential.
Yeah, I did. I did do the RD program when I finished my master's, but after being a registered dietitian for a couple of years, I realized it didn't that credentialing didn't benefit me, and I didn't really resonate very much with what the American Dietetic Association was advocating, how they did their fundraising. So I let that one go, and I'm now just a nutritionist. I live in Boulder, Colorado now, but I've lived in the Seattle area. I went to Bastyr, which is a naturopathic medical school, for my master's. And in Washington, the credentialing for an RD is just a bachelor's degree with the internship, but a
Uh-huh.
certified nutritionist is an implied master's degree. So in Washington, the CN actually gave me more credibility than the RD did. So it's different moving to Colorado because nutritionists aren't licensed and aren't certified.
Right.
So you'll find many different levels of study and education with that nutritionist title. So it's a little different here in Colorado.
Yeah, I kind of understand why you gave up your registered dietitian credential, only because I'm accustomed to their work being done in hospitals and things like that. Maybe
Yeah,
even in elementary and children's schools. But
yeah,
what I see in that field is a tendency to buy into the more kind of mainstream uh, dietary practices like low fat, high carb
yep.
eating.
Yep,
Um,
it's definitely a government regulated credentialing,
right.
or sponsored credentialing. Monsanto, Coca-Cola are the biggest contributors to the American Dietetic Association, which is a political mess. But you're right. Most of the people who go through that credentialing don't have the exposure to the holistic point of view of a human, and really making sure that the diet is balancing them as a person.
Yeah.
And it takes an extra bit of education to be able to solve those puzzle pieces and figure out what's going to balance someone, and to go beyond that basic nutrition education and beyond that government sponsored food guide pyramid a little bit, to really see what's going out there.
Now, the topic for today's discussion is joint health,
Hmm.
and um, this is obviously something I'm really attached to because of my work as a chiropractor involves joint health as a primary way to restore and create health and good performance. And so I'm really interested in the topic, and I just feel like this is an extraordinary opportunity here because I've had a chance to get to know Erin over the last year, and the conversation is always interesting, always engaging, learning something new every time I meet her. Um, and what we want to do today is talk about things that you can do to keep your joints from wearing out. I mean,
Hmm.
basically, I was talking a little bit about the numbers of shoulder surgeries and hip surgeries and knee surgery, replacement surgeries that we see these days. Of course, I'm 66 years old now, so I'm around a lot of people who are going through all of this joint replacement. And typically, the people who replace their joints are either just really unhealthy, just systemically unhealthy in the first place, or they're people who've been extremely active, who've
Yeah.
enjoyed tremendous physical activity throughout their lives. People who've been professional dancers and yoga teachers and you know runners and cyclists and all kinds of people, and
Yeah.
you know they get to age 60 and they have, their joints are worn out.
Yeah,
And
my mom was a ballet dancer and she's had both knees repaired and numerous shoulder surgeries. And my father played football in high school and college, and I think he's totaled 7 knee surgeries before, I mean, between the two knees before he finally had them both fully replaced.
yeah.
That's a lot of surgeries on some joints. Yeah.
So, I mean, the big question is, what's up with that? I mean, why are we having this epidemic of joint problems like this? I mean, this is a severe thing. I mean, there's other, you know, pre-surgery things that happen,
Hmm.
or non-surgical cases of joint arthritis and joint weakness, and problems with muscle and nerve and inflammation and pain and all that
Right.
stuff going on, and it's everywhere.
Right. And I don't think there is one answer, like what is going on. Everything is multifactorial. And yes, there are certain nutrients we need in the bones, absolutely. But we also need our parasympathetic nervous system to activate that rest and repair.
Right.
And we also have to have, stimulus, doing those exercises to give there's a component in the body called an osteoblast, and it's the bone building cell, and that cell needs to have stimulus from the brain. That plus, some nutrients we've been missing in our diet in this modern world. How many of you make meat broths and make bone broths and make chicken soup the way your grandparents did with the knuckles and the feet and the beaks and everything else? So there's just a lot of things we're missing, and you have to look at them all and look at every facet for a different person, because like you said, some of the people are extreme athletes, maybe it's just the nutrition they're missing. Some of them might just have that high inflammation in their body because of high stress or high impact, and some of them might just be lacking that nutrition, and so we have to look at all angles when we're trying to heal someone.
Yeah, yeah, it's really interesting in my experience too. And let's talk about the really obvious stuff before we get into nutrition, because
Hmm.
we're going to get into a little bit of technical discussion on that. And
Yeah.
from my experience as a chiropractor, what I find is that the basic patient profile is someone who's had an injury.
Hmm.
All right, and joints are not designed to be uh, traumatized very well,
Hmm.
And you go to a surgeon and they'll look at that and they say, "Oh, that's a degenerative arthritic condition, ready for surgery." And you say, "Well, why is that? And could I have prevented that from happening?" And what I hear is that each joint has its own history, and what I sense from past experience is that my paradigm for being healthy and well really didn't work out too well for me.
Hmm.
All right, my education about health was basically uh, don't do the things that your mother told you to do, not, don't do, if she told you not to do it, don't do it. All right, so that kind of excluded a lot of the growing up adventures as a young boy. I was pretty active, and I jumped out of trees and fell out of trees and jumped out of upper floor windows and off garage roofs, and all kinds of
Sounds
stuff
fun.
like that, and got in wrecks on my bike and on my motorcycle, and did sports like crazy, like pole vaulting in the old days. With when I was doing it in high school, you had a sawdust pit, and usually there wasn't any sawdust in it, or what you had was just a hard packed mass of decayed wood chips. And the we were jumping back then 11 feet into the air, and you come down, and you clobber yourself each time you
Yeah.
fall. I don't think joints survive high impact or high mass impact, in terms of speed and velocity. Either one of those, if it's high, it's going to get you. And then you'll get an injury to the cartilage, an injury to the ligaments,
Hmm.
and then those things don't heal very easily unless you go through extraordinary measures to restore them. Maybe not. So here's what I want to know from you, Erin. If someone senses that they have banged a joint really hard.
Mm-hmm.
Okay. First thing they'll do, what I like to do, is check out the joint and make sure that the mechanics are okay. The basic mechanics. Is the joint still lined up? And so is it moving in its normal range of motion, its normal plane of motion, so to speak, also? Are there any, misalignments that are causing neurological inhibitions and problems with muscle control, tight and short and long and weak muscles, things like that? Is the joint then in an environment and is it operating abnormally so it's going to wear out really fast? Try and get all that settled, all right, taken care of first, and then after that, how can you prevent the thing from actually running down, degenerating over time because of the acute injury that's occurred in sports or in normal living?
Right. Well, there's a couple parts to that question. You were saying that a lot of people who do a lot of high impact, or a lot of sports might be injuring themselves, but there's also people who just fall and create those injuries. So it can be acute or chronic damage, and that damage can be, it's addressed in the same way, but the length of time it would take to resolve something that's more chronic is gonna, actually it kind of depends on the person. But there's more things that can affect bone health than just that wear and tear, acute or chronic wear and tear. Menopause, for example, when you have menopause, the body's making less estrogen, and so you lose bone and joint mass more quickly. And when the estrogen drops, bone cells that break down bone, those osteoclasts, work faster than the bone building cells, those osteoblasts. So it takes a little more effort to heal if you're menopausal, or if you're low weight, or if you're inactive, because the lack of weight bearing exercise is going to decrease the stimulation from the brain of those osteoblasts to build bones.
Right.
If you have super high sodium intake, and I don't mean just the 2 grams of sodium a week that or sorry, a day, that most people should be getting for optimal health. I'm not a super dash diet, restrict your salt beyond health kind of person, but there's a normal amount of sodium that makes us healthy. And when you get below that, there's risks of health. And when you get above it, there's risks of health. And that high excess sodium can actually excrete calcium from the kidneys. High caffeine can do the same thing. Cigarettes can do the same thing, and so can alcohol. Extra fluid excretion can lead to more calcium losses in the bone. So there's the acute or chronic injury, and then there's all these other factors that you have to take into account along with the nutrition and along with the that stimulus your brain needs. But if we're looking just on the nutrition, there are actually 20 different nutrients
Right.
that improve joint and bone health, and not just calcium. And people hear the Got Milk, great marketing campaign. Fantastic marketing campaign, but it's not the panacea for joint and bone health that we want. And unless we're getting all 20 of those nutrients circulating in our blood at all times with that stimulus,
Yeah.
with the fight of gravity, then we're not going to get healthier.
Right. So why don't we then talk about the fact that joint health is not isolated from systemic health.
No, absolutely
That
not.
all of
And
those nutrients are not only necessary for good joint health, they're
right,
necessary for brain function and for
right,
digestive function and for biochemistry in general. Those are
right,
the fundamentals for good, vibrant, sustainable health, okay? So
right.
that's one thing. So let's talk about those nutrients. I mean, it's a fascinating study. And I
Mhm.
know from past experience you've told me that you're not a pro calcium supplementation person. So can we dispel that myth right now?
Yeah, absolutely. When y- all those 20 nutrients, just as you just said, they work synergistically together for bone health. And when you take one of them, and yes, calcium is the most abundant of the minerals in our body, but it doesn't mean that you can take it, by itself and not have it affect the other nutrients. In chemistry, there's a concept called a limiting reagent. And if you have, A plus B equals C, If you have 10,000 times of A and you don't have anything of B, you
Right.
still won't get to C. So
Yeah.
that B becomes a limiting reagent. And if you're doing nothing but eating calcium and you're not supplementing with magnesium and vitamin A and vitamin D and vitamin K2 and phosphorus and silica and boron and zinc and B6 and B12 and folate, then you're not going to get to C. So they all work in conjunction with one another. And the great thing about the human body is that these minerals and vitamins and cofactors are being used in numerous reactions around the body, and they all have a very delicate dance and a very delicate balance. When you take too much calcium, you're actually affecting the absorption rate of those other
Right.
divalent cations. If you look at the periodic table, those plus two cations, magnesium and zinc and copper and iron and others. So I'm not a big advocate of just taking, Viactive chews or Tums or other things. Mainly, one, it's because it's the cheapest form of calcium possible, and it's not very bioavailable. But also because it interacts with that balance of homeostasis of the other nutrients that we need.
Yeah.
Did that answer it?
Oh yeah.
And I
I
can go deeper into it. And maybe when we start talking about the nutrients as we need them in individual, I'll talk about, the pros and cons of calcium a little more. But that's why I don't say take one without the other. We need to look at the body as a garden and not a machine.
so what we're saying is that the by taking certain nutrients, you could be inhibiting or complementing other nutrients in your body.
Right.
And
But you
without
have
being intelligent about it, you could actually cause more harm than good.
absolutely.
Yeah, and you know, I would imagine in the medical profession for bone health, most medical doctors are still recommending that you take a calcium supplement like
Right.
Tums or something like that.
Right. And now
And
they're
yeah,
saying take vitamin D,
right.
which is good, but they're not saying take vitamin K2. You
Yeah, and they may
can't
not be
without
saying
K2.
take vitamin D3 either, you know.
Right.
So
Right.
so
Right.
yeah. So let's talk about this. Let's go through a just kind of a survey, a medley of all of those nutrients,
Sure.
and then talk about a practical way for us to make sure that we're getting them all.
Perfect. I
All
can do
right,
that.
let's
So
do it.
starting with the simplest thing of protein, um, we need protein is beneficial for the intestinal absorption of calcium. It's a major building block of those joints and bones. Now, if you get excess, excess protein, it can have to use calcium to buffer it out of the kidneys. But for the most part, we need just adequate sources of protein every day. Three ounce portions of protein is plenty. That dietary protein is going to impact not only calcium but magnesium retention. So you want to have what your body needs, but not too much. We don't need 25 grams of whey protein shakes in the morning and again at snack and again at lunch and again at dinner or giant steaks. We just need an adequate amount. And every food group but fruit has protein.
Right.
But since I'm naturopathically trained, I'm going to want people to get grass-fed, pasture-raised sources of meats if they're using meats for those proteins, because I don't want you to have those inflammatory cytokines and pesticides and herbicides. That bioaccumulation of those and antibiotics of those in the meat is really inflammatory for the body.
Right. Well,
So
yeah.
we want good quality sources of meat and fish and poultry and eggs and dairy if you tolerate it and nuts and legumes and vegetables themselves too have a lot of protein in them. So that plethora of food in a very diverse way will give you the different proteins that the body needs.
Thank you.
Yep. Going down, some list of other things that are really important. Vitamin C helps build that collagen for those joints, and not
Right.
only the joints but the teeth and the bones. And so we need those. It also stimulates the osteoblasts, those cells that build the bone.
Right.
So we want to get vitamin C in fruits and vegetables. Every fruit and vegetable. Yes, there's some that have more than others, but honestly, any fruit and vegetable is going to have vitamin C in it. So you want fresh fruits and vegetables as much as possible. If you can't go fresh, then you could go frozen. Canned is kind of a wash, whether it has any vitamin nutrient
Right.
quality in it. But as much as you can, eat a plethora of fruits and vegetables.
Right.
Let me keep going. There's lots. Vitamin A. You need vitamin A to help balance the deposit and removal of bones. So the osteoclasts break down and the osteoblasts move and or build, and vitamin A helps balance that.
Right.
But if you have too much vitamin A, it can affect vitamin K. So you want to get those sources from food
Right.
as much as possible. So vitamin A, you can get it from liver, sweet potatoes, carrots, spinach, squash. It's spring. I just went and did some yard work this morning. Get those dandelion greens from your yard while they're still fresh and organic.
Right.
And vitamin D. So we're always talking about vitamin D. Vitamin D helps you maintain the concentrations of calcium and phosphorus. So those two ions that help build the bone in the first place.
Right.
But what you need is vitamin D3, as you said earlier, cholecalciferol. And that's going to be the most bioavailable in the body. D3, cholecalciferol, and K2, and I'll talk about K in a second, those two vitamins work together to strengthen the bones and improve heart health. Basically, vitamin D creates vitamin K2 dependent proteins to help move calcium around. So if you're taking vitamin D, you're creating an increased demand for K2. And if you're not supplementing with K2 at the same time,
Right.
then your calcium is affected, your D is affected, and you're not moving those calcium proteins around, which means they can stay where they are, causing increased risk for plaques, increased risk for heart disease. That's why calcium supplementation without D3 and K2 is
Right.
known to increase your risk for heart disease
Yeah.
because we need K2 and D to move calcium around. So the best sources of D3 is going to be sunlight. Yes, you can get some fortified stuff in good forms, fortified milk or butter, egg yolks,
Right.
fermented cod liver oil if you're into that. But the best thing you can do is get 15 minutes of sunshine on your body at least 3 times a week. Because when your skin comes in contact with the sun, you make a sulfur-based D3 that's not available in vitamin form. It's supplementary. So
Right.
the best thing you can do is get that sunshine.
Now, for those
Yeah.
of us who live in northern climates in the wintertime, the angle of the sun apparently influences how much of
Yep.
that we can accomplish. But also, you know, even though there are some days in the middle of the winter here in Boulder, we can go without shirts or go without long sleeves,
Yeah.
excuse me.
Yep.
um, so, what is the best alternative if we don't have, access to good sunlight?
Yep.
I mean, I've heard people talk about different types of sun lamps or
Yeah.
tanning
So
booths.
there's a couple things. If you've got a southern facing window, take off your shirt, stay inside, and let the sun rays hit you through the window.
It'll come through the window,
It'll
okay?
come through the window. Also,
Okay.
it's a fat soluble vitamin, so it's stored in your liver.
Uh
I'm like pointing to myself like you can see me.
huh.
So it's being fat soluble, it stores, and you can have vitamin D stores that you build up in the summer
uh,
that will last you through the winter if you're
oh,
lucky enough to
interesting.
go out in the summer enough. But yes, sun lamps work. When I lived in Seattle, because I lived there for 15 years, I
Mhm.
bought the sunlight that's for sale by Dr. Mercola,
Uh,
Mercola.com, and that one worked really well. But if there's other lamps and lights you can use, but what you want to do is look for something that has a UVB ray between 290 and 310 nanometers.
okay.
So it's a UVB
Right.
ray between 290 and 310.
Okay.
Some of the lamps and lights, I'm pointing here because I have one. Some of these lights only have UVA, so you really want to look for that UVB. And
Okay.
that's what you can do for lamps and lights. But sitting in front of a window works, and getting it in the months that you have sun also works.
Okay.
Does that help?
For some reason, I was under the impression that if I sat in a window, that I wouldn't be absorbing the right sunlight. It would
It
be
might
filtered.
depend on it might depend on your E rating of your window,
Okay. Well, I'll have
right?
to
So
check into that.
probably
That's
each
a
window is going to be a little different.
Yeah, I could see having a solarium in my home, where I have a nice
Yeah.
opening in the roof where I can sunbathe through the window in the winter.
And it doesn't have to be a lot of your skin that's exposed. If it's 30 degrees outside, sit in a sunny area, but just have your forearms exposed for 15 minutes. It's
Okay.
all going to add up. Every little bit counts. We don't want to burn, but we do want to absorb some of that natural vitamin D. Again, that's when it absorbs through your skin, it becomes sulfonated, and
Right.
it's a more bioavailable form.
Well, I've also heard not to wash that off afterwards with soap and water. That if you can,
I don't
leave
use soap at all, so
leave it on overnight. I know we've had that
I
discussion.
don't I don't use
If
soap
we're
at all.
lucky, we could have Erin come back and talk to us about how to manage your
A
hygiene without
beautiful
having to use.
microbiome and garden on your
Yeah,
body. Yeah.
yeah, and I promise you, she's a well groomed person. So what's
So
next?
So yeah, we talked about calcium, we talked
Right.
about phosphorus, we talked about vitamin D, and all these things are interrelated and they need vitamin K.
Yes.
So what's important is I said D3, cholecalciferol, but it has to be taken with K2. And
Right.
K2 is minoquinone. K1, which is what they sell in a lot of the supplements, phylloquinone, is what's made by plants, green leafy vegetables. So if you're eating a lot of kale, a lot of broccoli, a lot of spinach, those kinds of things, you're getting K1. And that's great. It goes right to our liver and helps us maintain healthy blood clotting, activates those platelets. So it's a very important chemical and vitamin, but we really want K2, a different
Right.
formulation of it, to help us go into our blood vessel walls, bones, joints, and tissues. Okay. K2 is made by our bacteria in our GI tract, which is great, but it may not be, enough for your needs, especially if you have dysbiosis. If you're eating conventional meat that has those antibiotics in it, then you're pretty much killing your garden every time you take a mouthful.
Right.
So you really want to supplement with that K2 with the D3 if you can. Um, again, its role is to help move calcium. So if you're taking calcium and you're not taking K2, it's going to stay and build up in those arteries and bones and not move to the places you need. It's not going to help you lay down that strong bone matrix. So don't take calcium alone. Take D3 with K2, and I'll touch more on those, but I tell that to everybody over and
Okay.
over again.
Thank you.
Yeah. So all the nutrients kind of interplay with each other with, like I said, phosphorus and vitamin D and calcium and magnesium. And the thyroid is what helps us kind of keep that all in balance. The parathyroid hormone signals demineralization, bone breakdown, and then calcium levels, when they come up, signal the thyroid to release calcitonin, which decreases your parathyroid. And it's just this whole cycle, and they're really in a very intricate balance.
Right.
So again, magnesium, phosphorus, vitamin D, calcium, and K2. So um,
And to maintain your endocrine balance also,
absolutely, because
which
again, I
can you can
mentioned that
blow that
parathyroid,
from,
I
yeah,
mentioned the thyroid, so
yeah,
it's going to go and down to affect your adrenal gland.
right,
And if we're not balanced in all of them, then we're going to have some stress factors as well.
yeah, which is going to
Um,
get you pituitary gland, which affects your thyroid function, which
exactly,
affects your gonads and your
exactly,
metabolism, which affects
absolutely.
your, yeah. So it just
Yeah.
goes on and
So
on.
so by that train of thought, if you're taking calcium supplements off the shelf with Tums or Viactive or some of these other calcium carbonate brands, which are a little less bioavailable and
Right,
I call them cheap, but low quality is a better phrase. But if you're taking those, you might have effects with your testosterone, estrogen, progesterone, and DHEA balance. So
right,
yeah, it's all interrelated.
right,
Um, Calcium, like I said, interacts with magnesium. People always say calcium, calcium, calcium for bone health, and I disagree. To me, it's magnesium, magnesium,
right,
magnesium.
right,
Magnesium is involved in over 300 different metabolic processes. 300. So, like you said, these nutrients aren't just for joint health, they're for overall health.
right,
It controls the mineralization of our joints and bones and teeth. It helps us prevent bone thinning
yeah,
because the magnesium helps hold on to calcium. It's needed for the parathyroid release to make sure that we're absorbing calcium correctly. Magnesium inhibits phosphorus absorption. They all interact with one another. I love it. The chemistry kind of, I get too scientific and too nerdy, so I'll stop. But it's so much fun. So what you want to do is make sure you're getting the right amount for your needs. Excess supplementation causes confusion, lack of coordination, and other things, bowel intolerance.
oh yeah,
So you really want to make sure that you're getting things as from food sources. Like I said, K1, you can get it from those dark leafy greens, but you can't get K2 that way. K2, you have to get a good microbiome or you have to have
Right.
that supplementation. Magnesium is really easy to get in foods, but again, it's those vegetables, 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 vegetables. So you can also get it from legumes and whole grains, but those dark leafy greens are going to be really good for you.
Yeah.
Seafood's also a pretty good source. Everyone loves to say chocolate's a good source because they just want a reason to eat chocolate, but but really nuts, legumes, dark leafy greens are going to be your best sources, and you need that magnesium again to help balance phosphorus, calcium, vitamin D, and K2.
Good.
So getting more into that calcium, like we said, it has some benefits, but it also has some risks. Yes, calcium helps bone remineralization. Yes, it helps in the transition of nerve impulses or muscle contraction and blood coagulation, and it's secreted by the nerve cells. It helps in cell division. I'm trying to like do all this from memory. It's kind of hard. 99% of the calcium in our body is in our bones and
Right.
joints. So it's absolutely important for a macronutrient quantity wise. But quality wise, it's not the best thing to take on its own without having the balance of everything else to help it out. Excess calcium can inhibit the absorption of those other divalent cations, iron, magnesium, phosphorus, zinc, copper. Um, so we want to give our body what it needs, but not too much. So I always say go back to food because when you're eating good quality food, your body absorbs when it needs to.
Right.
Um, Milk and dairy products, if you can tolerate them. Small fish with bones, if you're eating sardines or salmon in the can, make sure it has those bones in it and eat those bones, crunch them up. The dark leafy greens, broccoli, chard, legumes, almonds, if you soak them and then blanch them, you can get a high calcium source. Otherwise, the phytate on the enzymes on the outside of the shell can kind of inhibit it.
Right.
But there's a lot of good ways to get calcium, but we think we need more than we honestly do. There are a lot of cultures that don't eat dairy at all, and they're doing just fine with bone health because they're getting high magnesium, high K2, and high vitamin D from eating kelp and fish and other sea vegetables that we're
Right.
not getting. So there's proof there that we don't need, calcium supplements. We need a balance of those vegetables. When you get calcium too much, there's an increased risk of fractures. I have got like 10 articles I can send you, all these journal articles, but there's a lot of evidence that says that calcium supplements increase fracture risk if they're taken without those other balanced nutrients. They have a detrimental effect on postmenopausal women. Um, calcium calcium loss from bone is slowed only when you're taking D3 and K2. I've got a list of journal articles I can send you if that would be helpful to the listeners. Um, so you're hearing me, but you're thinking to yourself, I still need to take calcium supplements, Erin. What do I take? Um, don't take Costco, don't take Trader Joe's, don't take Walgreens, Rite Aid brand calcium supplements.
Yeah.
Most of them are calcium carbonate, which is not very easily absorbed and actually can irritate the intestines. So if you hear me, but you say to yourself, I still need calcium, I still have an issue, then make sure you're taking maybe a citrate malate form with some magnesium, with some D3, and with some K2.
Yeah.
So I rattled out facts about tons of nutrients, right? Which is
Right.
why you wanted me here. But I just want to re-emphasize it's that proper balance, magnesium, calcium, K2, and vitamin D, that's really going to help you. But even if you have every single one of those supplements or vitamins and minerals swimming in your body, it's not going to do you any good unless you have the stimulus from your brain
Right.
triggering bone health.
Yes.
And that's not going to happen unless you're actually moving. So yes, we're saying people who have or athletes can cause chronic wear and tear, but they also have very strong bones. Every single time you flex a muscle and lift something heavy, you're actually creating little micro tears in your bone.
Yeah.
So not just a 5 pound weight, but get a 15 pound weight, get a 20 pound weight, do push-ups with your body weight. Um, those that weightlifting creates those little micro tears and it signals your brain to go and strengthen the bone itself. You probably know Wolff's Law, which is a bone grows or remodels in response to the forces and demands upon it.
Yes.
And that's it. A bone grows and remodels only in response to the forces and demands upon it. Bone is not going to grow just because you're taking calcium supplementation or you're exposing yourself to sunlight and getting your D3 with your K2. You can have all that always available in your body, but it's not going to trigger that remodeling. Mechanical stress is going to determine where that remodeling takes place. So you have to have that mechanical stress. So weightlifting, yoga, push-ups, dips, lunges, 2 to 3 times a week
Right.
with that proper diet.
Right. Now, there is an issue that some people have where their body has run down far enough so they can't do those exercises,
Mm-hmm.
you know. And that's where I step in because I need to help people get functional again
Yeah.
by offering them different treatments to line their joints back up because usually they've been punched out of position
Right.
and to get the pain under control so that they can comfortably move again.
Mm-hmm.
So I don't become discouraged when you hear Erin say weightlift, yoga, push-ups, all these kind of things that you may not actually be able to do at this stage in your life. But what
Yeah.
I would say is that go after, some joint corrective care to get things so they're more comfortable so you can move. My policy is not to move if it hurts. Okay,
Mm-hmm.
so that's different from what you hear from physical therapists who think that moving a hurt joint is going to rehabilitate it. Well, my perspective is that it will just hurt it further. So um, try and get yourself in a position where you're more comfortable. At the same time, if you're having joint pain, you might want to consider nutrition for inflammation
Yep.
because that will
Absolutely.
be a major problem there. And inflammation is the thing that gets in the way of joint health as well.
Absolutely.
So, can we talk a little bit about managing inflammation?
Yeah, absolutely. And magnesium is one of those great supplements that helps manage inflammation. But there's a lot of other things that cause inflammation that by taking them out of the diet, your natural balanced diet can help, restore and repair the body. And inflammation can be caused not only by physical stress,
Right?
but emotional and mental stress. So
Yes.
one of the first things we try to tell people is, you know, try to rein in your lifestyle as much as you can. Um, and people will always say, well, I can't quit my job. I can't, make my kids, pick up their clothes more than I already nag them. And part of that is true. Some of it's controllable and some of it's not. But what is controllable is how you respond to it.
Right.
A red light doesn't have to be an anger triggering event. And it's not for, for a majority of people. So you can decrease stress and decrease inflammation by changing your outlook.
Right.
And that's the easiest thing to do.
Right.
Well, simplest thing to do, hardest thing to implement. But it can be done. But other than that, if you can reduce exposure to painkillers, if you can reduce your exposure to alcohol, if you can reduce your exposure to, um, you know, the foods that are rich in the pesticides, herbicides, antibiotics,
Oh
those
yeah.
types of things, especially that meat and dairy. If you can eat organic meat and dairy, then you're reducing inflammation in your body tremendously.
Right.
When people go organic, the first thing they start buying is the fruits and vegetables. And while I'm all for it, I eat, as much of an organic diet as I can. If you're if you're trying to be conscious about how you're spending your money, go first with organic dairy and meat. Because
Yes.
the bioaccumulation of those hormones, pesticides, I have a 4-year-old behind me. Hold on. You need to go ask dad for help. No, get out. Seriously, go. All right, hold on. Okay, what was I saying? So, the bioaccumulation in meats, because of the exposure of this, what's been sprayed on the grains and the grass and everything that those
Right.
animals are eating, has a higher effect of inflammation in that animal. And so when we consume those products, we're eating those inflammatory cytokines. It's going to have a higher inflammation in our bodies.
Right.
So if you're trying to pick, budget wise, what should I eat organic?
Yeah.
Go for organic dairy, go for organic meat, because that's going to reduce your inflammation. So
Good.
those are simple things you can do. And then um, the FDA has their food guide pyramid, and it's ridiculous. It's full of grains and it's full of, sweets and fats and that are unhealthy. And my food guide pyramid is really simple. The base of your pyramid, I'd say, from the bottom to two-thirds, a third up, should be vegetables.
Right.
Vegetables, vegetables, vegetables. Those are anti-inflammatory.
Right.
And when you cook them with healthy nut oils or coconut oil or um, even rendered tallow or olive oil, those things are going to be healthful for you.
Right.
Make sure that what you're cooking oil wise is not the temperature beyond that oil's needs. Like olive oil is a medium heat oil.
Right.
And when you cook it so high that it smokes and flashes, then that's now become inflammatory. Throw that out, start again with a medium heat.
Right.
But those nut oils, healthy olive oil, coconut oil, pastured, organic butter, ghee, those kinds of things are going to be healthy for the body. Get vegetables into your system as much as you can. And then healthy proteins. And then those healthy fats and those starches, the grains if you eat them or legumes, even fruit. All those things, grains, fruit, and legumes are all starches, and we need them in our diet. Don't get me wrong. I'm not advocating that we only should be eating vegetables and protein because it's too hard on the adrenals. We need some starches in the diet. And whether you want to use squash or fruit or, quinoa as your starch, they're all needed for the brain. Our brain needs
Right.
that glucose. But it should be a quarter of your plate,
Mm-hmm.
not the base of your plate with a tiny little bit of parsley on it and call that a vegetable. It
Right.
should be a plate of vegetables with a tiny little bit of those starches. And it could be an apple, or it could be a half a cup to a cup of quinoa. But we need some starches in the diet. So that's why I put them at the apex of my pyramid.
Yeah. Let's talk a little bit about inflammatory fats. Okay. So,
Yep.
um, I grew up at a time when the uh, food processors were lobbying with, government to come up with statements like you need to use polyunsaturated oils and not saturated oils because it's, the saturated oils are going to kill your heart.
Right.
And so we grew up with not only consuming things like Crisco, which was a,
Right.
trans fat, really terrible, awful stuff.
And you have, I can't believe it's not butter.
Yeah, and then we had margarine,
Right.
substitute butter.
Right.
Butter was cut out of our diets. And then your mother cooked and fried with Wesson oil,
Yep.
and basically corn oil, safflower, all of those kind of seed oils. And my understanding, later on was that all that stuff was bad. That as soon as those seed oils like corn oil and safflower oil are made, at the moment they're manufactured, they turn rancid right away because they're so extremely reactive with oxygen.
Pretty
And
much.
then when you heat them up
Yeah.
and cook with them, basically what you're doing is you're rancidifying your entire meal. So you're turning it into like this poisonous food-like substance that's just basically setting off an inflammatory cascade of inflammation in your body each time you eat it. So if anyone out there has been educated to think that these quote polyunsaturated or healthy quote healthy oils,
Mm-hmm.
you really need to look more deeply into it. I was shocked later on to find out that you should be eating tons of butter and coconut oil and olive oil and
Yay!
ghee
Yeah.
and all
Yeah.
the things that I liked in the first place, all the things
Right.
that I would eat whenever I was outside the house.
Yeah. Well, I grew up in the 70s and we I grew up in the same thing. It was I can't believe it's not butter and Crisco and hydrogenated oils and what we had in our cabinet was vegetable oil.
Right.
And it just didn't even have a name, it just said vegetable oil. And the the fear from that from saturated fats came during, I think it was mostly in the 80s, maybe a little bit before then, when people were starting to get cardiovascular disease, and the scientists didn't know why. And they correlated cardiovascular disease with high cholesterol. Correlated.
Right.
Correlated. So they said, okay, well then cholesterol must be bad. What has high cholesterol? And they realized that these saturated fats and animal meat and flesh has higher cholesterol than say broccoli does.
Right.
Well, of course, because all animals need cholesterol. It's a molecule that moves fat-soluble vitamins within our aqueous water-based bloodstream. It's a necessary component and it moves things around. Of course, but broccoli doesn't need that. It's a completely water-based, I mean, yes, it has a little bit of vitamin K and vitamin A in it, but it's not the same complexity with our hormones and neurotransmitters
Right.
as mammals are. So they vilified mammals and oils and fats from mammals, and we took all the fat out of our meats and started, selling lean meats, and we started selling, you know, skim milk and non-fat milk, which is crazy because skim milk is only like 2 to 1% fat, and full fat milk is only 8% fat. So when I tell people to go to full fat milk, they look at me like I'm crazy, and I'm like, you're getting 92% fat-free milk when you're eating full fat milk, and that
Yeah.
makes it a little better. But we have vilified fat, and we have vilified cholesterol,
Right.
and all based on this correlation that we're now disproving, and more studies are coming out to disprove that cholesterol is inherently bad for us and will cause cardiovascular disease. And we now know it's inflammation that does it, and not cholesterol.
Right.
And yes, you can have good, like healthier or unhealthy balance between LDL and HDL, but that's completely dependent upon your diet,
Yes.
and that can be changed by changing your dietary fats.
Right.
And as you alluded to, there are a couple different types of fats: the saturated, the polyunsaturated, and the monounsaturated. And those chemistry terms just describe which carbon bond is a double bond.
Right.
When you've got zero double bonds at all, and it's the thing is full of hydrogens, it's full, it's saturated. When it has one double bond, it's monounsaturated. When it has many double bonds, it's polyunsaturated.
Right.
And you can have a polyunsaturated, 3, 6, 9, 12, 15, 18, 21. It can go all the way through. It's every third, just because of the way the tertiary structure of that saturated that fat is structured in its three-dimensional form. But there are many polyunsaturated fats. The monounsaturated fats do not affect LDL or HDL cholesterol. And a good example of that is olive oil. That's why everyone says just eat olive oil. It's great for you. Don't worry about it. But of those polyunsaturated fats, it could be a 3, 6, 9, 12, 15, 18, 21, run the gamut. But there's two of them that are essential for us. And that's omega-3 fatty acids and omega-6 fatty acids. And those two, 3 and 6, are used to build the rest. So if you get 3 and 6 in your body, then through metabolic processes, it's the arachidonic acid cycle, you can actually make the 9, 12, 15, 18, 21, 24. You can make all the other fats your body needs. So we need to have both 3 and 6 in our diet. The problem is we have gone 0 with the 3s and full bore with the 6s because they're cheap.
Yes.
The 3s are volatile. Cold water fish, flax oil, borage, evening primrose. There are a couple others. But the omega-6s are shelf stable.
Right.
They're actually stable to oxygen at moderate temperatures. They're stable to higher temperature ranges. And so we started using them to manufacture all of the goods. So canola oil, you named them, safflower, sunflower, corn, soy, cottonseed. Those poly-6 oils are used in every box, every bag, every package, every food you buy at a grocery store, everything in a deli, everything in a restaurant. Anything you're not making at home is using one of those oils because they're cheap.
Right.
And soy oil and corn oil are the most ubiquitous oils, and canola, sorry, I missed that one. Those three are the most ubiquitous oils in the American diet.
Yes.
And that's why we have um, uneven numbers of LDL cholesterol to HDL cholesterol, because those poly sixes increase inflammation and increase LDL cholesterol.
Right.
And the omega 3s, the cold water fish, evening primrose, borage, those decrease inflammation and and increase HDL. But these are so volatile that people don't cook with them anymore. So we've got too much LDL, too much inflammation because of the oils that we're eating. So you
Right.
can decrease inflammation by getting rid of those poly 6 unsaturated fats.
Right.
You can't get rid of them completely because they're essential fatty acids. We need some of them. But if you eat out once a week, you're probably doing fine. And we have too many of them in our diet.
Yes.
So what we want to do is steer people toward healthy saturated fats
Exactly.
like uh, coconut oil, which has got a lot of medium chain triglycerides in it, and you want to eat pastured butter or ghee if you can. So coconut oil, butter, ghee, tallow if it's been rendered from a pastured organic
Exactly.
animal,
Yeah.
those types of things. And if you're eating meat that's made that, or have been raised that way on grasses, not grain finished, but completely on grasses, then the animal meats and the animal fat is going to be full of healthy saturated fats and conjugated linoleic acids and things that are healthful and anti-inflammatory.
Right.
But if you're eating meat and dairy that's been raised on corn and soy and cottonseed, things that are inflammatory, then the
Right.
meat of that animal and the dairy of that animal is going to be inflammatory.
Right.
So to decrease inflammation, we have to go to quality.
Yes.
Quality meat, quality dairy, quality coconut oil, quality olive oil that hasn't been um, uh, diluted with corn and soy oil like a lot of them are in the market. And you
Yeah.
really have to read labels.
Well,
Make
it's
sure
not
that
on
you're,
the labels. I mean, a lot of
yeah,
these. I mean, there's information out on the web now that talks about how the extra virgin olive oils, even the imported oils,
yeah,
are being. What do they say? What do they say? Uh, well, anyway, they're being
they're
combined with
diluted. Yep,
cheaper oils
yep,
like canola oil.
yep.
Yeah.
So we have to, you know, do research, buy reputable brands,
Yes.
make sure that you're getting anti-inflammatory fats and anti-inflammatory oils in the diet, and then again, not cooking them beyond the temperature that fat and oil can um, can be heated to without it going rancid.
Good. This is all really good. Yeah. Yes, it just calls to mind when I was in chiropractic college. There was a young girl at a school I was visiting, and she was at the vending machine, and she was reading the labels on candy bars to see which one had the least amount of fat.
Yeah, because we vilified fat, and there's only really three things you can do with food. It's the protein, the fat, or the starch, the sugar.
Yeah.
And when we took fat out of our diet
Right.
to get the same texture and to get the same kind of balance, they increased the sugar.
Mm-hmm.
And so all these fat-free products are really high in sugar. And since they've done that in the 80s, we're getting fatter as a nation
Oh yeah.
and more increased
Majorly.
risk of diabetes and more increased risk of these inflammatory
Yeah.
diseases because we're eating way too much sugar. And it could be sugar itself, or it could be starches, or it could be fruit. It's just too much sugar. You go to Jamba Juice, and a 16-ounce thing of Jamba Juice, depending on the flavor, is anywhere from 80 to 120 grams of sugar
I know.
because they put not only sherbet in it, but they might have, one leaf of kale, but then it's all this fruit.
Yeah.
And people don't think of that fruit as also being that sugar. And that's why in my pyramid, I put your fruit and your grains and your legumes all in starches because it's too much load for the body.
The Jamba Juice used to, I don't know if they still do, they used to put quite a bit of high fructose corn syrup in there too.
Oh, that's even worse. I don't know.
Yeah.
I
Let's
think
not
I've gone
go
there
there.
I've gone there like twice in my life, maybe if that, and I was appalled.
I checked into it. I didn't go there.
I think I went there once and I said, "Can I sub the sherbet for coconut or not coconut? Can I sub the sherbet for carrot juice and can I sub the whatever for strawberries and can I?" Yeah.
So, Uh, this is really good. So now we've talked about joint injury and what you can do to heal your injuries. We've talked about the nutritional support for joints. We've talked about the necessity for you to exercise and do weight-bearing exercise in order to implement, turn on Wolf's Law, which is to strengthen your bones.
You didn't think I knew that one, did you?
I knew you knew it. We had to talk about it. You forgot, but we had to talk. Wolf's Law pertains to bones, but the same is true for muscles and tendons and ligaments.
Absolutely.
And cartilage.
Yep.
If you put structures under stress, the body
Right.
responds in a corresponding way of getting stronger.
Yep.
So, you want to spend a certain amount of time using your body. And, you don't think about that so much when you're younger. You really
Right.
don't. I mean, fortunately, a lot of young people around here are extremely active. I mean, Boulder, Colorado is the home of a most wonderful, our city park is a mountain hiking trail system. So hiking is just like everywhere. You run into all your friends on the trails. It's just the greatest thing. So there's cycling and biking and cycle racing, hiking. There's snowboarding, snow skiing. So many people are doing triathlons now. It's just like a huge fad here. You've got this cyclocross stuff that goes on in the winter where people are pounding out the bicycle track. I could go on and on and on. There's an activity for everybody. I mean, even
Right.
some of my really elderly patients, they play pickleball at the Y, People dance. They dance a lot here. There's huge amounts of dancing.
Yep.
So our lifestyle is active here in Boulder, and you're the exception if you sit around at night and watch, and glue your eyes to the screen in your
Right.
home.
Right.
You're kind of the exception. And so being active is a given here. Now, if you're not in that position, then just think about adding some activity. One night a week, go and stand on the risers in your church and sing in the choir just to get on your feet for one evening.
Yeah.
Exercise your lungs.
Yep.
But we've got this need to be active in order to remain active.
Mm-hmm.
If you don't remain active, then your joints will weaken and then you can't be active.
A body at rest stays at rest.
You won't have strength to be able to do stuff. Eventually, you won't have the strength to do your normal activities of daily living. You won't be able to lift up a 5-gallon pail of something, paint or I don't know what comes in a 5-gallon pail. But I mean, there's certain requirements, and you just can't let yourself run down to the point where you can't take care of your activities of normal daily living.
And you listed out a lot of very vigorous exercises, but there's also very gentle ones you can do. Pilates, yoga, Nia, which is, and if you're trying to rehabilitate yourself, you can start with water aerobics. You can start with just walking.
Walking is great.
Hiking is great too, because we're not talking about speed. We're not saying how much you have to do. We're just saying get out there and do some weight bearing. And your body weight is weight.
Yes.
And so we always have to remind people of that. Another thing that helps is have a friend that exercises. That there's 3 degrees of separation. So if you're within 3 degrees of somebody who's healthy, it actually influences you to be healthy.
Oh, yeah.
So you can help the others around you, and you can help yourself by picking the right environment and peer group that will help you stay active.
I'm always cautious when I have patients who come in and they've been injured for a long time, so they've been inactive for a long time. And we solve their joint problems and they're out of pain. Now they want to become active, all right? We warn them. We hold them back. We hold them back because you have to be sure that you have a good baseline of fitness before you start doing, strenuous exercise.
Yeah.
Right? So I always start them out on walking. And then once they get to and you'd be surprised, it takes a lot of conditioning to get into walking for a half an hour once you haven't been doing it for 5 years.
Right.
It's quite a bit of exertion.
Yeah.
You don't need any more than that, all right, at that time.
Right.
But what'll happen is you'll find that you're walking, but you kind of want to take a few steps and jog a little bit because you just want to move some more. Because the reality is, is that movement is bliss.
Yes,
Movement produces happiness.
absolutely.
If you're unable to move, you don't know what you're missing, okay?
Yeah.
There's a reason why people like to move. That's the
Yep.
reason why people like to be physically active. It's because it's the greatest thing ever, all right?
Mm-hmm.
And I remember talking to you last week about, it's kind of like life is kind of like a hot tub. So if you lie in the hot tub and you don't move,
Mm-hmm.
you don't even know you're in the hot tub.
Yep.
I mean, you can't really enjoy the hot tub unless you move in the tub and you create some waves and stir it around a little bit.
You don't know how hot it's getting. Yeah.
Then you feel the waves and the thrill of the whole motion of the tub. So life is kind of like that. If you're not moving, you're not stirring. And if you're not stirring, you're not living, because life is movement itself.
Yep.
All right?
I agree.
If you're not moving, you go out of existence. That's
Yep.
what death is. All right?
Yeah.
Yeah, you just stop moving.
Yep,
So,
yep.
the important thing is to have baseline fitness at all times. You really need that. If
Yep.
there's something preventing from you, then remove that obstacle if you can. If you're paralyzed in your lower body, then move your upper body.
That's right.
And vice versa. I mean,
That's
I
right.
used to teach people yoga, who couldn't get out of their wheelchair.
Yeah.
But there's a whole lot of cool yoga you can do just using the upper body.
Yep. And sitting in a chair. Yep.
Yeah, sitting in a
Absolutely.
chair. Yes. And so, get your baseline fitness up. That's all that you really need,
Mm-hmm.
But if you can, then move on from there. If it feels good, then start doing it, okay?
Mm-hmm.
And if it's dancing, if it's yoga, if it's hiking, if it's bicycling, if it's weightlifting, and there's a lot of benefit from weightlifting.
Absolutely.
As you get more, as you get older, weightlifting becomes a really good thing.
Mm-hmm.
But make sure you're doing it safely, that you're not hurting yourself when you do it. There's technique. You need to pay attention to that.
Yep.
And so everything has to be done gradually, building up your baseline. From there, building up your ability to do things without injury.
Yep.
And you need to remember that your muscles will develop faster than your ligaments and tendons.
That's
So
a good point.
You
Yeah.
might be able to lift something just fine, but if you haven't been lifting for a long time,
Yeah.
you need to increase in very small increments below the amount that's comfortable for you to lift, because your ligaments and tendons have to build up along with,
Yeah.
they have to keep up with your muscle strength.
Yep.
So that's just my 2 cents worth as a clinician. I see all kinds of injuries, and people injure themselves lifting
Right.
weights. People injure themselves doing yoga, and it's supposed to be the healthiest thing ever. But there are a lot of yoga injuries. There's different
Yep.
ways of teaching yoga, different ways of practicing it.
Yep.
Some more safe than others.
Absolutely. So I think the bottom line that we're both saying is eat balanced nutrients,
Yes.
exercise, but one thing we forgot to say is hydrate.
Oh, thank you.
So, half your body weight in ounces of water every day. Hydrate, hydrate, hydrate. And that's just as important as the eating right and the exercising.
Good.
And not black tea, not green tea, not white tea, not soda, not juice because it's too much sugar. You really need the water.
You need the water, and I always tell people, if you're going to cheat and drink something that's diuretic, like coffee, you need to replace that with an equal quantity of water.
That's the same exact information I give. Yes, enjoy your cup of coffee if you need it and doesn't affect your adrenal glands, but it doesn't count toward your hydration needs.
Now, there's
Absolutely.
another thing I want to remind people of, and that is that if you live at sea level, you're fine. Half your body weight in ounces, that works just fine. But now when you live up here, we're a mile high here.
Drinking more. I'll drink something while you say that.
Drink more. Like, you need to do that half of your body weight plus 8 ounces per 1,000 feet in elevation, because the pressure is less here.
Yep.
So when the pressure is less, evaporation happens much faster.
Yep.
And it's good to drink, at least here in this area, I recommend a quart of water or a liter of water first thing in the morning, because you get up in the morning, you're already down a quart, so to speak, okay? So the sooner you can replenish that, the faster your metabolic processes will be running at their optimal, and then you're ready for the day.
Yep.
So try and do that before you drink your coffee. You don't want to
Absolutely.
further deplete your body from water. Thank you for
Absolutely.
bringing that up. And as far as cartilage and ligament and tendon health go, all of those nutrients you're talking about are going to impact those in a major way.
Mm-hmm.
All the same principles hold for inflammation, but
Mm-hmm.
you did bring up the principle of making and drinking bone broth.
Oh, I did.
And
Yes.
what I like about that is that there are not only incredible minerals in that.
Mm-hmm.
Um, like if you have tooth sensitivity, do bone broth for 6 weeks and it'll probably go away.
Yeah, and bone broth has to be done correctly. So again, we want to quality. We want to get those bones from organic, pasture-raised animals. And there's a difference between meat broth and bone broth. And if you're a very vital, healthy person, bone broth is great. But if you have digestive issues or if you have a high joint inflammation, joint pain, then a more gentle meat broth is a little better for you. And
Uh,
that has to do with the timing of how long those bones or and ligaments and joints are boiled.
right.
Um, you do want nice joints and cartilage on the bone, so you don't just want a long bone with marrow in it, but you want the tendons and the ligaments and the attachment points. If you can get feet, if you can get knuckles, if you can get those kinds of things, it's going to be a richer broth for you.
Yeah.
And boil it for 6 hours with some meat if you want a gentler approach. Again, if you have a lot of injury or a lot of inflammation or digestive issues, or you can boil it 24 hours to 2 days
Right.
if you're looking for a richer bone broth. But when you're doing either, put a couple, maybe 1 to 2 tablespoons of apple cider vinegar in the broth, because the acidity of that acidic acid will help mineralize or demineralize those bones and get the minerals into the
Right.
broth. When I do chicken stock, I boil for usually 24 hours to 48, and I want to boil so long that I can actually crush the bones with my fingertips.
Right. Yeah.
And then I eat the cartilage. My dog's always jealous because I'm eating all the stuff that she wants. I share sometimes with her, uh, but you
Yeah.
want to be able to consume those. And
Right.
that's what my grandmother used to do. That's what my great grandmother and generations before did. They ate healthy ligaments and bones in soup form, creating that gelatin because it's going to help our collagen and give us the protein and minerals we need.
Right.
Um, but another thing you can do, I think I just lost my train of thought actually. Doot, 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 doot. I did. So
Well,
it
hold
went,
on. Then I'll talk a little bit. Then it'll
okay,
come
go.
back to you,
It
okay?
might.
Because this is an important topic for me. But when you have all of the connective tissue associated with a joint,
Hmm.
and remember to add bones that are joints, not
Hmm.
just long bones, you get all this incredible quality glucosamine and chondroitin.
Yep.
These are the soft tissue.
Hmm.
These are the cartilage, ligament, tendon nutrients. These
Well,
are
with
really
with L-glutamine, and you need that
yes,
as well. Yep.
yes,
Because that also
yeah,
gonna come out in those bone broths. It's not gonna come out in the chicken stocks you buy in the store.
yeah.
You have to boil it yourself and get those nutrients in there.
Very rich stuff, and for some reason a very extremely absorbable form, along with the
Hmm.
minerals.
Hmm.
Very absorbable form.
Hmm.
And I've seen people do bone broth once and have their whole body just light up.
It's
The
amazing.
first time, just
Yeah.
drinking a pint of bone broth.
Yeah. Well, there's a thing called the GAPS diet, and it's the gut and psychology syndrome or gut and physiology syndrome, as Dr. Natasha McBride has just kind of adopted both acronyms. And what she does is have people eat bone broth or meat broth a cup or two a day, every day for months.
Right.
And she's seen people heal themselves not only from physical injury, but that diet, because it's based in those nutrients in the bone meat broths. It's reversed people who have ADHD and Alzheimer's and schizophrenia. It's amazing if you read her
Yes.
book and if you look at her studies what
Huh.
she can do with bone and meat broths.
Well, thank you.
Yep.
Yeah.
Yep.
So, if you do all these things, you're going to have good joint health.
Yep.
And the idea is to remain active for life.
Right.
I mean, it's very common that I have people come in here who love to do distance cycling, and they're 65 to 80 years old, and they tell me that they want to do this until they fall over dead. They don't want to be in a position where they're in a convalescent situation for the last 10 years of their lives, or even the last minute of their lives.
No one does.
the idea here is that particularly if you're a young person, you don't see the need because everything is fine for you. All right? But keep your joints working mechanically well. Make sure, and the one way you'll know that is that your muscles will be extremely strong. Your joints go out of function, then your muscles will weaken. And you shouldn't have nagging pains that come and go. Shouldn't have that. You can have a little joint soreness or a little bit of muscle soreness from working out, but not pains.
Right.
So get all that taken care of.
Right.
And then get the right nutrition. Don't just run off your DNA for the first 40 years of your life, which is what a lot of people do. They've got their genetic inheritance and they use it up. They hit 40 and then everything falls apart, right? So try and build your reserve. And like Erin was saying, it's kind of like vitamin D3, I didn't know that you could store it so that you'd have enough supplies for over the winter. That is a super idea.
Yeah, it's a fat-soluble vitamin.
Well, a lot of this structure that you develop as a younger person, that's going to determine what you're like when you get older. And so keep going, keep feeding yourself well, keep strengthening yourself, keep your joints healthy, and chances are they'll stay healthy for the rest of your lives.
Yep.
But also use your seatbelt, okay? That's one of the big
Agreed.
things that I see. I mean, I just treated somebody recently, and they were in the car with their daughter, and they drove off the road going down the canyon from Estes Park.
Oh, no.
And flew 20 feet down and crashed, and one of them was thrown from the car, and the other one was banged up in the car, Wear your seatbelt.
Yeah.
Wear your seatbelt. That's one of the best things you can do from a public health standpoint. That's like one of the first things that you're told to reduce risk of being ill.
Yep.
Well, thank you, Erin. Is there anything else you'd like to add before we sign off?
I would just say if you're you're seeing a chiropractor like Dr. Groover and you're getting the joints and bones in alignment, and you're doing the bone broths, and you're eating a balanced diet and you're getting that nutrition and it's still not improving, then come see someone like me, someone who's trained. It could be an issue with hydrochloric acid in your stomach, not being able to break down the food enough. It could be something else. You never know. So ask an expert. If you're taking all this advice and still not getting anywhere, seek out an expert.
And Erin is here in Boulder, Colorado. I've had patients who've seen her and really love her. I would say that from what I've seen so far, having known Erin for a little while here, I can definitely recommend her without reservation.
Thank you.
Her company name, her nutrition business, so to speak, her consulting is EZ Balance. Okay, so that's the letter E, the letter Z, Balance. And her website is ezbalance.com. All right.
Yep.
And she's available. You can get in touch with her. There was one lady who came in here and she said, "Oh yeah, I think I got my problem solved. Erin came over to my house and we went through my food, all the stuff in my pantry and my refrigerator, and we threw it all away."
Sorry. But she's healthier now.
Yeah, and now she's eating better, and she said that largely took care of her major digestive problem that she was having. I think it totally took care of it.
Well, I didn't just throw her stuff away. We talked about what she needed to do in addition, and we got her good quality food, and that's what healed her.
Yes, but the fun part to me was just hearing her say how everything was thrown out of her house, basically, and anything you could eat basically had to go. So you'd be surprised how easy it is to clean things up if you ask for professional help.
Absolutely.
I know for me, I get really attached to stuff. It's been around a long time, but then I look at my cabinet and I realize after a while I sober up. It's been in there for 6 years. You know, I just got rid of a whole bunch of pasta. We don't even eat pasta in our house anymore, but there was some specialty pastas. There was one pasta that was like 2 feet long that my wife had bought. She thought it was so adorable. And this was like 6 years ago.
Yeah.
And it's
There's
just
no nutrients in that stuff left anymore.
just
Anything
sitting
that's got
there.
that long of a shelf life isn't feeding your bacteria.
Right. And
It's that simple.
so I'm, going through and cleaning this stuff out. Sometimes you need some help. And I was really impressed that Erin would take the time like that, because she's a professional, to go to someone's house and help them clean things out. I've given them instructions to clean things out, but I would imagine that it's kind of hard to implement, particularly
It
if
is.
you're one of those kind of people that, gets attached to stuff, but, the impression I get is an Erin there is really to help, and she'll figure out what you need from an emotional, psychological point of view, as well as a nutritional point of view, and work with you and come up with a program where you can put something into action where you're going to notice a change right away. So, and if you're an athlete, I've got a guy that just did his first big bicycle race. He competed in 100-mile uh, mountain bike race in Leadville. It's called the Leadville 100, and he made it through the whole thing, finished, in the required amount of time. Never done anything like it before, as far as I know. Trained up really hard for it, and he really relied on Erin's nutritional advice during the process. He was very satisfied. He's just the happiest guy. He just had a great time doing it.
He's a rare person who wanted to gain weight.
Yeah, and he did. He's
But he
gaining.
did, yes.
Yeah, he's
Yeah.
doing well. So, it's really fun. It's really fun working in cooperation with Erin, and I'm looking forward to doing it for many years in the future.
Oh, me too.
And
Thank you.
Erin, thank you. I mean, you've been a real inspiration for me. The depth of your knowledge and your personal philosophy just really checks out really well with me, and it's been a real privilege to know you.
Oh, it's been a pleasure to me too. You've helped my neck, so thank you.
You're welcome. And so goodbye, everybody, and get in
Yep.
touch with Erin if you want some help taking yourself on to the next level.
All right. Thanks everyone for your time.
Bye-bye.
Bye bye.